Well, hi everybody. This is Dr. Schroder with your video introduction to week number 2 in our course in Professional Concept of Nursing. Of course, this is the first course in the RN to BSN program, and my primary concern with you in this course, among other things, but one of my primary concerns is just that you settle into and get into a nice habit of schoolwork, and that you are able to tackle all the little technical issues that we have to deal with when we're working in an online internet-based program. And for that, I am very pleased. The discussions went excellent this week. The discussions that you've been asking have been very good. I encourage you to ask a lot of questions. If something doesn't seem clear, if something isn't working correctly, please let me know, and I will go ahead and help to clarify and help to get things fixed. And so in week number 1, the primary discussion, or the primary focus, was your discussion question on nursing as a deontological based profession. And in other words, that's really says, are we a profession that is bound to duty? The idea here is that is nursing an altruistic profession, or are we a profession like any other occupation? In other words, do you just hang your hat up at the end of the day and say, I'm not really a nurse anymore, and it's just kind of sort of a job that I do? Or is this something that you carry with you all the time and that it becomes incorporated in your life? That's a theme that's going to be repeated several times throughout the course. We talk about it here, we'll talk about it in leadership and management, and we'll also talk about it in nursing theory. Your first your first weekly reflection this week was your weekly reflection on the Shelley book Call to Care, which was discussing the nursing as a Christian-based profession. And of course, that's really what the focus of the Shelley book is all about, is this idea that nursing is at its heart a profession that is based in a certain a certain Christian theology. Now, that doesn't mean that you necessarily have to be, look at it from a religious point of view necessarily. It doesn't mean that we're nurses out trying to proselytize, but what it does say is that our core concept of nursing is to do betterment for man, and that's part of this Christian worldview that we'll be discussing all throughout the program. It's an important part of our program here at Azusa Pacific, given our Christian worldview. And so it's going to be reflected in a lot of your teachings all throughout the class. And so, again, I was very impressed, very happy with the discussions. I think that everybody is pretty much on track. You've got a pretty good knack as a class of getting in, and I don't need to take a lot of time getting a lot of prompts going. You've noticed that my primary participation is to come in and ask a lot of new questions and maybe give a few answers to things that seem unclear. And that's that pattern will continue both in this week and in the coming weeks. In week number 2, you're going to be tackling your first paper. Now, for some of you, this may be something that is either old hat or it just doesn't seem like that big of a deal. For some of you, this causes great anxiety because everybody's all over the map when it comes to writing skills. And so I just want to let you know at this point, do not worry about it too much. Writing is a skill just like any other skill. It's just like every nursing skill you possess. It's just like every communication skill. It gets better with practice, more practice, a lot of feedback, and a lot of patience. So I will be giving you feedback on your giving you feedback on your papers when you turn them in at the end of this week. They will be due on Sunday night. Please review the syllabus for the paper description. I won't go into great detail about it now, but it is a little bit open-ended. It's essentially you're going to discuss professional nursing and what it means to you is kind of sort of the basic theme. And please refer to the APA helps, the APU library links that I have listed give a lot of really good resources to help you with your writing skills. Also, there is I posted a forum announcement. Somebody, one of the classmates or class members had posted a question about, is there a resource available for online students to get individual tutoring by a librarian and by a writing expert? And indeed there is, and I posted that in the discussion forums. You can make an appointment and plan to meet with somebody to go over your writing. The writing that we use in the program is almost entirely APA writing, and that's a specific type of writing. So I will be posting information about that as we go along. I'll be giving you feedback after that first paper, and then you'll be applying that information also later on. when you write your final paper in the class, which will be in week 6. A total of 2 papers in this class, one in week 2, one in week 6. The discussion questions this week are going to focus primarily on the your first introduction to nursing theory. Now, this is not really a course in nursing theory that we're in right now, but we introduce the concept. What is theory all about? What is a theory? And why in the world does it pertain to nursing? And so that's really what we're going to be discussing in this first discussion question. Nursing theory is a basis for practice. And then also we're going to be focusing on patient safety. QSIN is an important part of any nursing program. Nursing safety is something that we should all be concerned in, and so we're going to have you review some materials and discuss nursing safety. And then you're also going to have a weekly reflection, again, continuing on this concept of nursing. And the basis of nursing theory is what we call the nursing meta paradigms, which are health, person, environment, and nursing. They're 4 overall overarching concepts. And you're going to reflect on those as nursing practice. Is it a calling? Is it something that people are called to do? Or like I said, is this just like any other vocation? Does it take a special set of qualities in order to be a nurse? Or is this something that anybody can learn to do? Different ways to tackle that. And so I'm going to be interested to see your reflections on that and be giving you feedback as well. Again, everything is going fantastic in the class. I think that everybody, if you're wondering if this is like how a class should look and how it's going, it most certainly is. I will be grading your discussion questions, and you'll be getting your first grades by the weekend. Usually we try to get stuff done within about a week when it comes to grading. It takes a little bit of time sometimes, so look for your grades sometime later this week, most likely, I'm guessing by Friday. But it may be into the weekend before I get all of the discussion questions graded. So I look forward to participating with you in class. I would just like to pray for you with a minute and say, Dear Lord, thank you for this time together. Thank you for bringing this course together, bringing this class together. And we know that we're doing so for your purpose. I pray that you touch all of us, bring us peace, bring us love, bring us all those things that are just so important in life. And maybe we remember you, and maybe we remember our purpose in what we are called to do and the caring that we are called to provide. Help us to learn in the program, help things to go well, and just, Lord, thank you always for the blessings you give us. We pray in your name, amen. And with that, I will leave it to you to continue on the discussions. Let me know as you have questions. I will be posting office hours later this week. I'm not sure exactly what my time frame is going to be, but they will be posted later this week. So God bless, keep it up, and I look forward to seeing you in class.